Hi, everyone. Welcome to the Go-To Aesthetics Coach podcast. Today, I have a very exciting opportunity to have a guest speaker, Dr. Malika Ladha. She is someone that truly inspires me so much, and I've been so excited and literally counting down the days for this conversation. So I'm going to do an introduction, and then we're going to jump in to some really exciting questions and conversation around the art and science of aesthetic dermatology. So Dr. Malika Ladha is Alberta's only female cosmetic fellowship trained dermatologist. She's bringing a unique blend of artistry and science to the field of aesthetic dermatology. She's known for her warm and collaborative approach. Dr. Ladha is deeply committed to helping her patients achieve optimal skin health and refined, natural looking cosmetic results. She is also double board certified in both Canada and the US and specializes in neuromodulators such as Botox and Dysport and dermal fillers, including Sculptra. After earning her medical degree and completing her dermatology residency at the University of Calgary, she further honed her expertise by completing Canada's only official clinical fellowship in laser surgery and aesthetic dermatology at the University of Toronto. She later served as medical director of a prestigious clinic in Toronto before returning home to Edmonton to provide cutting-edge dermatological care. Beyond her clinical practice, Dr. Ladha is a published researcher and an active leader in several top-tier medical organizations, including the Canadian Dermatology Association. She's a former resident and fellow society co-chair, the Women's Dermatological Society, American Society for Laser Medicine and Surgery, and she's also recognized as an educator and industry leader, having received coveted accolades such as the 2021 Resident Doctors of Canada Medical Education Award, the 2021 Royal College of Physicians Leadership Award. Dr. Ladha is passionate about empowering patients through education, advocating for ethical and evidence-based aesthetics, and staying at the forefront of innovation in dermatology. When she's not in the clinic, you can find her reading, swimming, writing, playing pickleball, which I love, or spending time with her husband. Okay, so Dr. Ladha, I would love to give the floor to you if there's anything else you want to add to that. I'm so excited to get into this conversation. Thank you for being
Well,
here.
first, thank you for having me. I'm so excited. I remember when we met a couple years ago, and I feel like this podcast has been a long time in the making. So I'm super excited to be here. Thank you for reading my very long bio. You made me sound incredible, but no, I'm super excited to learn from you and have this conversation.
Amazing. No, thank you so much for being here. Honestly, I'm so excited. You are a true inspiration to all female entrepreneurs. Okay, so the first question I have for you is what initially inspired you to specialize in aesthetic dermatology?
Yeah, absolutely. I think the question even for me goes a step back, which would be like, why dermatology? And dermatology for me, I love it so much because it's really amazing how different aspects of the tools that we have can come together for our patients. So we have medical therapies, we have surgical therapies, we have public education, and in all of it, and by bringing these tools together, we really get to develop relationships with our patients. Skin is something that affects everyone to some degree. At some point in everyone's life, they've dealt with a different skin condition. It is our largest organ. And so to be able to meet patients from different backgrounds, all different ages, it's really special. Our skin contributes to our confidence. And so to be able to help people with that is very rewarding. And then specifically for aesthetic dermatology, it is truly a privilege to be able to work in a place where you can help people feel their best, find their confidence. And I think for me, this is such a growing field, aesthetic dermatology, but to be able to combine it with science, artistry, see all the new advances, help with some of the advances, it's really rewarding. And I feel super grateful to be able to do it.
Oh my gosh, I love that. And it's so true. I feel like aesthetics is so much more than, beauty from the outside. It really comes from within, and it's so much more meaningful. There's a saying that I always like to say, it's look good, do good, feel good, because it truly is that, right? Like when you have that, you feel good, and because your confidence is there, like it truly changes how you show up in life and how you feel.
100%. And I think there's like this misconception that it's like this vain, I'm putting this in air quotes, like this vain thing to do. But the way I see it is that some people will spend hundreds of dollars on their hair and getting it a certain color. And some people go to the gym. Obviously, we go for health reasons, but some people go for aesthetic reasons, right? To build the biceps that they want. And some people get their neuromodulators and fillers. And I think ultimately what's amazing about this is that everyone has the choice to do how they want to do it and show up how they want to show up. And for those people who really value that, like we're here for that. And I think what's really amazing too has been is seeing the shift, right? Before no one would ever talk about aesthetics, and now it's okay, it's welcomed that we have this conversation when we go out with our friends for dinner, or in passing. It's not taboo.
Yes, exactly. No, I love it. It's such a ever-growing industry, and that's what makes it so exciting is that it's just growing at such a fast pace in such a beautiful way. So, no, I love it. Very well said. Okay, next question I have for you is,
Absolutely.
can you explain the significance of being double board certified and how that actually impacts your practice?
Absolutely. So I'd love to walk you through the journey of becoming a dermatologist because sometimes it amazes me how people don't know that. And I think it's really important. I do. And so to become a dermatologist, you have to go through official medical training. And so this starts with usually 4 years of undergrad for most people, and then into medical school, which is usually 4 years in Canada and the United States, and then moving into residency. And so after medical school, everyone has to complete residency.
Okay.
And in Canada, every specialty residency, so for specialization, whether that's internal medicine or surgery or ophthalmology or dermatology, it's a 5 year program.
Wow.
And then after that, we go on to get certifications. And so there is a massive exam that we all complete at the end of residency. And in Canada, that's through the Royal College. For dermatology in the United States, it's to the American Board of Dermatology. And so to say someone is double board certified means that you've passed those examinations in Canada and the United States. And that examination and having that credential is required in order to be able to practice as a dermatologist. And then the fellowship component is, so most people practice after residency as a dermatologist upon graduating, but fellowship is an extra year of official credited training in whatever area you pick. So in dermatology, there's the option to do, for example, pediatrics, surgery. And then in Canada, we have one fellowship training spot in lasers and aesthetics. I mean, that's at the University of Toronto under two very big pioneers and mentors in aesthetic dermatology. That's Dr. Vince Bertucci and Dr. Kusi Pon. And so that year is an opportunity for an entire year of training under these two amazing teachers.
Wow. Oh my goodness. What a journey.
It's a road. It's a long
Wow.
road.
Well, it's truly, it's so inspiring. And we're so lucky to have people like you who have, devoted your life to that journey and bringing such a beautiful, um, perspective to dermatology. I have to ask, so what is it that, after so many years of schooling, I was like 13 years of schooling, what is it
Yeah.
that pulled you to do another year? Because I'm sure after all those years of schooling, you're so tired and you're like ready to like start work and like getting into it. But like, what is it inside you that pulled you to be like, no, I'm going to stick into it and do another year for the fellowship?
Yeah, absolutely. You're right. It is a long journey. An additional year, well, it only seems like a year, isn't a whole full year. But for me, came down to a couple of things. I knew that I'm a perfectionist and I wanted to have that extra training so that the goal was to become the expert's expert, right? And so having that training, that dedication from my fellowship directors, and that clinical experience, it is a year, but I feel like hopefully I'll be rewarded the rest of my life for that year of curiosity. And I think it was just such a beautiful opportunity to grow, learn, and connect. And with that, too, I think another component of it was the exposure to research. And so, like every aspect of medicine, having clinical evidence is very, very important for us to be able to make recommendations, safely administer treatments, and ensure that we get the best and optimal result for our patients. And so during during fellowship, one of my fellowship directors is very heavily involved in research across aesthetic medicine, has done some of the pivotal trials that have brought a lot of these treatments to Canada. And so that was really amazing to have that exposure to understand the process of the clinical trials and to participate in them.
Wow, that is amazing. And I'm sure it's not an easy process to get into the program. Like, wow, congrats to you. That's amazing.
Thank you. Yeah, and I think it's part of the cycle of medicine where mentorship and teaching is such a big part of it. And I hope to continue to be able to contribute to that cycle too. It's there's that phrase, right? Like see one, do one, teach one. And so I've been lucky to be able to have seen and done and now contribute to the teaching of it too.
Amazing. I love it. Okay, on to the next. So, how does your fellowship training enhance your approach to aesthetic treatments? So,
Yeah,
yeah.
that's a good question. So a big portion of my training was the consultation process.
I love that.
And that is a very important and I often find underrated component to this evolving industry that we have. So to me, the consultation is the most important part of
Yes.
what we do. It
Yes.
truly,
I love
truly,
it.
truly is.
So true. It's so true.
And like it's important. Like the reason I love this field on a day-to-day basis where I see patients is the
Mhm.
long-term relationships we get to build with patients.
Yeah.
And I don't see it as this one-time transactional thing where someone gets paid for something. It's more of this journey that we go on with patients, right? And I think the consultation piece is so important. And why it's important is because there's obviously the medical aspect of it. I want to learn about patients, their medical history and and their medical conditions and their allergies and that sort of thing like that. First and foremost, health first. So we do that part. But the other part of it is like getting to know people and like what do they value? What's their lifestyle? Can they accommodate downtime? And we get to learn a lot about people's personalities. Are they looking for immediate results? Are they going to be a patient and let some of these treatments kick in? And so I think the consultation piece is the main driving force of all of this. And then, of course, what the consultation is the examination component of it. And this was um, the experience that I like love that I got from my fellowship is really being able to analyze faces. We're looking at not just one component in by itself. Like we're not just looking at the lips when someone comes in to see if they're a candidate for a lip filler. We're not just looking at the cheeks. It's looking at all these different pieces. How do they fit together? What is the harmony there? What is the balance there? And I think why this is so important is because it prevents the cookie cutter approach. It's not this like template that you just take and like paste onto the patient. It's like really looking at the patient and deciding with them in conjunction with them what makes sense. And part of that too is having like a very honest conversation. And I think a really important skill I learned from fellowship too was when to say no for treatments and how to kindly say no. And I think that's important because we have to make sure that what the patient is looking for matches what we can provide. And I think we all need to get on the same page with goals around it.
Exactly. And like providing like realistic goals. And it's not just a quick sale. It's like exactly. Oh my gosh, I you probably saw me like literally smiling so much as you were talking because I'm a huge believer in this and this is something that I really like to talk about when, from the consultative side of my business when I'm talking with clinics is yeah, I do. I see that the consultation part is often like it's like almost wanting to be rushed in some cases, and it's like no, 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 that this is the most valuable part of the journey because it's like you said, like we get to actually get to know this person for who they are and we get to build the relationship in that time, so it's more opportunity to like what you said, like to actually see their facial features and know their history, but also build the relationship so that you can convert this maybe from just a one time stopping client to like an ongoing client, because again at the end of the day we're human, and it's not just a transaction, it's like you said, like a journey. That's literally what I say with clinics. So I love that you this is so important to you and that you just touched on all those points because it's super important. And I also love like
Mm.
and now I'm oh, what were you going to say? Sorry.
No, no, you first.
Oh, I was just going to say I'm so curious to know like where you picked that up in your journey, Was it the fellowship portion of the journey that you kind of got this, or maybe it was always in you? Maybe that you're a very like human centric person, but I'm curious because it's not always the case.
I think it's two components. I'm someone, I'm like a social person and I love to get to know people.
Yeah.
It's like my favorite part of my clinic days. You know, when like we're in a really privileged position as physicians, patients share within seconds to minutes like some of the most intimate details of their life. And so like I'm always honored with that trust from patients. And I love getting to know people. And I love when people come in. Sometimes I think the journey starts for patients with like a special event that's coming up or a difficult event that's been happening in their life. And so it's like also like really amazing to see patients follow through on these different parts of their journey. So I think, yes, one component is like I'm a social person, I enjoy it, and I really value that. You know, I kind of think of what fulfills me, and it's the relationships that I have in my life. And so that's always very important, whether that's in my personal life and professional life. And then absolutely like credit to like my fellowship directors because they're both, it's also important to them and how they bring it into their clinical practices. And I think that fellowship year was like very instrumental in helping direct maybe some of those personal skills in that professional setting, within like the aesthetic dermatology space. Absolutely.
My gosh. Yeah, I mean, I can definitely attest to like when I first met you a couple years ago, when you walked into the room, you really come in with this warm presence. You can your
Mhm.
passion just like exudes
Thank
off
you.
you. And you're literally just someone like just hearing you get up and you're talking to us about dermatology, about skin. And I was like so encapsulated by everything that you're saying because it's just like you really care about this. You're super passionate. And you bring a bit of a different approach, and I love it. And I remember just thinking, wow, I need to get to know this person more.
That's like so sweet. Thank you for sharing that.
No,
That's like
truly.
very, very kind and sweet of you to share that. Thank you.
No, it's true. And I know that other people think the same. And it's really nice because to put like when you think of it, putting yourself in, the client or the patient's shoes who's coming into a clinic to see someone, sometimes it's scary. Sometimes they're scared, right? And
Yeah.
when you have that approach and that energy about you, it just kind of puts all like it can put a lot of your nerves at rest and it gives this open capacity to like talk and feel comfortable, and there's like a trust there as well. It just like you make it not transactional. So I really really like your approach. I think it's beautiful.
Thank you. And you know, I think like the other part of it too is like, and this sounds so cliche, but it's like, how would you want to be treated if you were in the chair, right? And like I can tell you, even though I do these procedures all the time, I also get nervous when I sit in the chair. And so it's always when someone else is there providing that ease to me, it makes all of the difference. And so I think it's very important that we do that. And like you mentioned, sometimes people are scared. It's natural to be scared. I tell patients that it's normal to be nervous. But I think it's, if we have that warm, welcoming, non judgmental too space, it makes such a difference for patients.
Wow, no, we're very lucky to have you in this space. This is amazing. And as a
Likewise.
leader, like I feel like you're touching on all very important parts. So I love it. Okay, so now I wanted to kind of jump into choosing the right provider. We kind of already touched onto this, but what are the key qualities that patients should look for when they're selecting an aesthetic?
I think there's a couple key things to look at. So, absolutely, education is a big part of it.
Hmm.
And I think it's so important to be able to ask your aesthetic provider about their education. Um, a
Yeah.
weekend course, it's hard to learn from just a weekend course. And I think there are a lot of transferable skills between different areas of medicine, but a weekend course isn't the same as spending months or a year in training for this. And where I think the education is so important is that it helps providers to understand the anatomy and to be able to do that full facial analysis, understand the science and the data behind the products and the devices being used. Ultimately, I think it also together is looking at how do we provide the most safest and the most optimal outcomes. And I think with education, the other part is experience, and that hands-on experience is so important. And where I think that experience is important is obviously in the delivery of the results, but it's not just simply about like where do I hold my needle and inject. It's also about recognizing the side effects, being able to treat those side effects, right? Like side effects can happen. Obviously, we reduce the risk when we know what we're doing, but it can happen to anyone. And so being able to understand, recognize, and treat is very, very important. And I think what we all forget at the end of the day, sorry, no, I'm going to reword that.
Yeah.
I think what's really important to remember is that these are all Health Canada approved drugs and devices that we're using. And so it's not just simply the same as I'm going to go get my hair cut or get this sort of manicure. Like these are actually Health Canada approved drugs. And so to me, it's very important that everyone in the aesthetic industry do informed consent. So, is your provider talking about what this product is, potential side effects, aftercare? Are they available to deal with the side effects? And I think that's like very important. And then, I know on social media we see like these glamorous places we can go to and these glamorous experiences. And yes, that's a component of it, but ultimately, like I think that healthcare aspect is the most important aspect. As a physician, we take this oath where it's like first do no harm, and that's like I'm a physician first, and I will always think back to that. So I think that's very, very important. We always remember that through every patient interaction. Anyone who comes to me, and this is like a distinction I have, but anyone who comes to me, I refer to them as my patients, not my clients, because to me, I'm a physician doing this, and I think that's very important. And then I think, you also have to find someone that you vibe with, someone where you're able to build that long-term relationship.
Yeah.
I think that's very important too.
No, I completely agree, and those are really good points. Yeah, I mean, it's so important who you're going to get these procedures from because there are risks. And yeah, you do. It's like you spend time with this person and you are trusting them with like a needle sometimes, and it's like yeah, you
100%.
want to feel comfortable and those are so important. So I totally agree with you. And
I
even
think
when
like,
yeah
oh, sorry, go
yeah
ahead.
no go.
Like other things to like look for. So obviously we've talked about the education, the experience, making sure that that medical aspect is taken care of. I think photos are really, really important
Yes.
for like the patient and also the provider. But I think it's very, very important that we have that. And I think in a very positive way, right? Like I think patients to be able to see their progress through these different treatments that they have. And I think again, it's very underrated as a tool in assessing finding the right provider. This was actually a very big part of my fellowship training with Dr. Bertucci. And I spent so much time learning from him on how to take these photographs and how to keep them consistent throughout. And I know we're like, this is like heading in a different direction when I bring this up, but I think too, like related to social media, like these befores and afters, so much is filtered and so much is edited out there.
Mhm.
And sometimes when I look at befores and afters on social media and I see different lighting, different positioning, I think those are critical aspects to take note of because that might not be reflective of a true result.
Absolutely. And I can't agree with you enough on that, especially like having, being in the marketing space. That's something that I'm
Yeah,
always talking with clinics about is how important like this I see like photos are like gold for your business, not only because it's, showcasing your work and your expertise, but also because it's really important, like as you mentioned, for the patient to see where they started, where they're going, the progression and having that history, right? Like it adds to the expertise and the credibility, I think, of the practitioner.
absolutely. And I think it's like always amazing when you've had patients for a certain amount of time to be able to go back to their first photo.
Yeah.
And because every time we look in the mirror, we don't necessarily appreciate ourselves, every single detail or change. And, there's this idea of perception drift has also been published too, where over time, as we get treatments and things change, we forget what we originally look like and the positive changes that we're seeing. Right. And a lot of, at least my approach is these are like subtle enhancements and tweaks
Hmm.
to preserve like the patient's natural beauty. And so again, not taking that cookie cutter approach, but really making sure we focus on the patient that we have. And so those photographs are so nice for part of that journey. And it is an investment, right? To have the right photography equipment, the right secure storage for that. But I think it's like an investment worth making for that patient journey.
No, absolutely. I couldn't agree more. And what I'm really taking from the conversation so far, like two parts of that, like in terms of what clinics might find beneficial is yes, like take the time in that consultation and take the time to do the photos. And these are two key attributes that are so important to a practice. And yes, it does take time. And I know like days are busy, but very important, very important. So thank you so
Yeah,
much for
absolutely.
talking about those. Yeah. Okay, so in extension to we were talking about what patients should look for in a provider, what would be red flags that patients would see?
I think when there's providers who don't do all the things we've talked about, right? Like take that medical history, do that thorough examination. I think where things there's no explanation and things are rushed
Mhm.
is really, really important to consider. And then, if a provider, and we were just talking about this, but doesn't take the time to go through the possible side effects or risks, I think that's a red flag to me. A lack of consent forms, I think. And that's not something patients might always think about, but at least from this side, that would be a red flag to me. And I think where it feels like it's a transactional process is a red flag. And I think it happens a lot, unfortunately. Um, and I think too, and this might be hard as a patient to recognize this, but when the patient comes in and asks for one thing, but there's no analysis of everything else. I shared with you earlier that one of the things that I learned from my fellowship was how to say no, to recognize when the treatment's not appropriate, but then how to say no. And some days I feel like I say no more than I say yes. And that's because I don't believe in if a patient comes in seeking, let's say, lip filler, if they don't need it, I'm not going to give it to them. And for me, there's three parts to that. So one is you first do no harm, right? And so that oath comes into place. And the second thing is it's wrong for the patient. I don't believe in that. I guess those two kind of fit together. But then the third part too is like my name is attached to someone when I treat them, right? And for me, the goal is always for patients to be asked if they've gone on vacation and why they look so relaxed, not for people to notice that they've had treatments done. But if they do choose to share with their family and friends, your name is attached to that at the end of the day. And I think I'm very mindful and cognizant of that because I want my work to speak for what it is.
Yeah, absolutely. It's like your patients are really like a walking billboard, right? For your brand. And
Yeah.
I really appreciate that too, like your perspective on that because it's ethical. And that's the way that we should be doing things instead of, maybe, just making as much money as possible no matter what and not considering everything. Yeah,
Yeah.
it's so important.
Yeah. And I get that these are like businesses that people run,
Yeah.
but I think it's really important to take that like healthcare lens to it. And at the end of the day, if we do what's right for the patient, like that rewards that process in so many ways, right? And I do find when I'm direct with patients and I explain to them, I think that education piece is really important. So not just going in and saying, no, I'm not doing this, but like really like holding the mirror, showing them their photos and explaining why you think the treatment that they're interested in is not appropriate for them gives patients also like an understanding and maybe even validation. And I think when I do consults, I don't ask patients what treatment they want. The question I ask them is I always ask them what their favorite feature is. And then I always then move into like, what is the goal here? Like, what are you trying to change or achieve? What's bothering you? And then I think if we start with that, then it becomes easier for me to help bring in my experience and tools and knowledge to be able to build them a treatment plan.
Yeah, that makes so much sense because maybe what someone's coming in for isn't actually what they want based off those questions to be able to map out a plan that makes sense for their unique anatomy. So,
Yes,
yeah.
absolutely. And it's just like, okay, like when my car breaks down and I go to the mechanic, I say like, please fix this. It's not like I'm asking them to insert
Yeah.
this tool into this and like do it this way because I don't have the knowledge or the expertise to do that. And I think that's like similar in some of this space as well, is it's a collaborative approach. And I like really appreciate patients trust me with that information and then like give me the like honor and the space to be able to give them a plan.
Yeah.
And I think the other like really important component you were asking me about red flags
Yeah.
that plays into this like journey is when there's no follow-up.
That's a good one.
And I think that's like very important. Every patient I inject with neuromodulator for the first time, it's non-negotiable. We book the 2-week follow-up before I even
Good.
do the treatment because At the end of the day, I want to make sure that they're happy with their result. I'm happy with their result. I'm probably my own toughest critique, but I appreciate being able to do that. Same thing with hyaluronic acid fillers, laser treatments. Like it's bringing those patients back for follow up.
Yeah. No, I agree. It is so important. And I love that you don't skip past that. You really don't miss a beat. It's good.
No, it's again, it just came with like the fellowship and the training um and like wanting what's best for our patient.
Yeah, absolutely. No, I'm like, I'm gonna book in with you next time. I'm around because I'm like, I already love it. Okay, okay. So let's go into care and customization. So how would you ensure that each treatment plan is tailored to the individual needs of a patient? We kind of went into that. We pretty much went into
Yeah,
that. Yeah. I mean, is there anything else
totally.
that you would add? Yeah.
I think too,
Like,
like yeah, the
yeah,
other thing to add is like we have so many different tools, right? And so it's like finding how each tool works best for the patient. And this is where I believe so much in the power of combination treatments.
I love
And
that.
to be, yes, it's so important. And I think this too is like maybe a green flag for like an aesthetic provider is like what tools do they have available to them? And a red flag, I'm just going to add, sorry, I know we're
Yeah,
jumping all over
no,
the place, but
please. This is great.
a red flag to me is like not knowing the limits of your treatments as well. And so,
Mhm.
like when I see a patient, if I think a surgical option is going to give them more optimal results, or if any treatment I offer them will not give them benefit, I'm very direct with patients about that. And I think sometimes that doesn't always happen, and where patients are getting treatments, unfortunately, that aren't going to have the same effect as a surgical treatment. And so part of my fellowship training was also being able to recognize that and implement that. And so if you have a provider that's not able to do that, like that's not good for the long-term goals here.
Exactly. No, that's a very good point. Okay. All right. So I know we have about 15 minutes left, so I'm gonna okay, let's
Go by fast.
go. Okay, I know, right? It's like I feel like I could talk to you for hours. There's so many, you have so much
Likewise.
information. Okay, but let's talk about some common misconceptions in patient education a little bit more. So, what are some of the common misconceptions patients have about aesthetic procedures? Is there any that kind of come to mind?
One always, and I think you and I have talked about this before too, but is this like concept that people are going to look fake when they have these treatment procedures. Now, unfortunately, there are people walking around where you can spot from a mile away that they've had some sort of aesthetic procedure, but there's also people that walk around who've had aesthetic procedures and it's undetectable. Unfortunately, they don't have a walking sign on them saying, I've done A, B, C, and D. And so patients only recognize the ones that have not the ideal aesthetic outcomes. And so this is a conversation I always have, and it comes up all the time, even in my medical dermatology practice where patients are slightly interested. No, I offer some of these aesthetic procedures. The first thing that comes out is, I don't want to look fake. I don't want to look different. So that's a very common one. I'm sure you hear that too often.
Yeah.
Yeah, yeah, exactly. So that's one of them. And I think the other one that often comes up too, and specifically around injectables, is that if a patient stops doing these treatments, they will suddenly age overnight where their skin is sagging and they look 20 years older than they would have if they hadn't done those treatments. And so that's a very big myth that often comes up. Do you hear any other ones?
Yeah, I just thought of one as you were talking. I wanted to ask because when I do hear now, there's a lot of talk I feel like about fillers.
Hmm.
Especially since like the Kardashians got their fillers dissolved and this and that. You know, there's like kind of a buzz about this.
Yeah.
Um, is it like what's your take on if someone has had fillers over a course of 10 plus years? Is it moving and making the face puffy over time? Is there ever a point where you need to dissolve your fillers and kind of redo it? Or how it like what's the background with that?
So I think, okay, first, the studies that are done for filler look at these patients maximum a year and a half after they've been injected. And so there was this common um, uh, train of thought or sharing with the patients that fillers last up to like a year in your in the areas that they're injected. But we know that it lasts beyond that, right?
Mhm.
But if they're injected correctly in the right place with the right product, Fillers don't migrate, they don't move. So anytime we see suddenly this like puffy look syndrome or swelling in different areas where the filler's not intended to be, we know it's been injected incorrectly. And that's not the fault of the filler, that's the fault of the injector.
Okay.
And I think it's really, really important to make that distinction because you're right. Fillers are getting a terrible rep on social media as this thing to avoid, but they're a great tool. These hyaluronic acid gels are there's so many different uses for them and so many ways to be able to incorporate them into a treatment plan. And when done elegantly, they look beautiful.
Yeah.
And so I hope to see more education around that on social media. Another myth around this that I find that's been coming up is that
Yeah.
hyaluronic acid fillers replace biostimulatory fillers. Sorry,
Mm,
sorry, the other way. Let me say that again. Another myth that's coming up is that biostimulatory fillers are a replacement for hyaluronic acid gels. And again, this is around this new buzz of using less
yeah.
filler on social media. And I have to agree that previously there may have been a lot of overfilling by different providers. So I can see where this is stemming from. But to me, these are two different tools and they have their own uses, and one does not replace the other.
Okay, I love that you talked about that because that is something that I actually hear a lot of talk about now. It's like fillers or biostimulators, and it's like there's actually like a place for both, is what I'm hearing you say. It just depends on the
It
person,
just depends on the person, their goals, their anatomy, and what we're looking to achieve and what timeline as well.
right? Okay, and I have one more question extension to that because I this is interesting. So, and this may just completely depend on the person in front of you, but say you have someone coming in starting to get injections for the first time, fillers or biostimulators. Is there one that they would start first or it just depends? Like is there one that's
It
recommended?
depends.
Okay,
No,
okay,
I
yeah.
would say it depends. Yeah, absolutely. And that's like where that personalization and tailoring and comes into play. Like if a patient has significant volume depletion, we're probably reaching first for the hyaluronic acid gel fillers. But if we're looking for a treatment that will improve skin quality and give the effect of a little bit of dermal tightening, we're probably reaching for that biostimulatory injection.
Makes sense. And that exactly ties into everything that you've been talking about. Is like if someone walks in into your clinic, it's just they say, okay, I want, I don't know, Sculptra. But maybe once you actually do that full consultation and analysis, it's like, actually, what's best for the goals that you have is the filler. So yeah, no,
Yes,
I love that. So much expertise
absolutely.
behind it. Yes. Okay, let's see where we're at. So, okay, let's do a couple more questions on trends, advancements, and ethical considerations. So, how do you stay current with all the advancements and trends in aesthetics?
Such a good question. Part of being a physician is that we commit to being lifelong learners. And so on the medical side, there's always new advances in therapeutics for different skin conditions. For example, in the world of psoriasis and eczema, there's so much that's new. And every year we get more and more new therapeutic drugs. And the same thing on the aesthetic side. There are now more indications for some of the existing treatments that we have. There are new treatments coming out. For example, there is a hyaluronic acid gel filler in combination with a biostimulatory filler being put together in one product, and that's going to be coming out. There's new devices coming out all of the time. I know it's such an exciting
I love
time.
that.
And so, totally. So, staying current is very important. And it's important because we get new indications, we get more safety data, and it's really important to be able to keep on top of it. The way I do is through some of the journals focused on aesthetic treatments. For example, the American Society of Dermatological Surgery publication will often have articles on these topics. And then conferences is a really big way as well to be able to learn from other experts in the field, to be able to learn from mentors in providing these treatments.
I love that. Okay, Dr. Ladha, I know that I want to be respectful to your time and I know that we're coming up here. So I want to leave it to you for kind of the last touch point as to, to all the physicians and nurses and practitioners, clinic owners out there. Is there anything, like one last piece of information that you would leave as terms of advice or just like a key piece of information that you've taken on your journey that you feel is very important? I know we've touched on a lot of things, but is there anything you want to leave us with?
I think always it's probably a repeat of what I've said,
Yeah,
but
yeah.
putting the patient's best interest first from a health perspective, from an ethical perspective is very important. And it will not only benefit the patient, but I think us in the industry as a whole. And I think it's very, very critical that all of us take on that responsibility. And I often find even the patients that I say no to, they're so grateful for that, and they end up forming a that long-term relationship with you. So I think it adds value for them, it adds value for us, and I think it respects the integrity of aesthetics as a whole.
100%. And I think that's exactly like very well said. It's a very respectable approach and it's the right way to do things. It's the right way, the pathway in aesthetics. So thank you so much. Like you are such an inspiration. And I would love to kind of end this
Thank
off
you.
on truly. I would love to end this off on how can people reach you? Where can we find you? I know that you have, of course, your Instagram account, which is at Dr. Malika Ladha, and I'm going to have that in the keynotes from this episode. But where find you?
Yeah, I feel like Instagram is a great way
Yeah.
to connect. And then at conferences, like, please come say hi. I love, you guys already know this now. I love getting to meet people and getting to know people. And so I'm really excited.
Yay! I know you're such a social butterfly, and that's why I love talking to you. You're so passionate. So thank you so much. I would love to have you on here again sometime in the future. And yeah, oh, one more thing, because I know that you're also an associate at a practice. Do you want to let people
Yes.
know, yeah, about that, where they can
Yeah.
find you there?
Absolutely. I practice medical and aesthetic dermatology at Stratica Dermatology in Edmonton, Alberta.
Okay, okay, I'm coming. I'm gonna come
I
see you
can't wait.
soon.
It'll be so fun.
Okay, thank you
Thank you
so
for
much,
having
Dr.
me.
Ladha. I appreciate it, and I hope you have a wonderful day. And we will talk soon.
Absolutely.
Bye.
Bye.